Welcome to the CountryWatch Political Intelligence Briefing Quick Hits, a weekly briefing of hot stories across the world in brief. I'm Denise Youngwood-Coleman, and I'm the Editor-in-Chief and Senior International Affairs Analyst at CountryWatch. It's been a year since the World Health Organization declared the COVID-19 coronavirus to be a global pandemic. So this week, I'm doing a coronavirus anniversary edition and marking this sober time in our human history. I'm looking at how a sampling of countries have been handling it. First, the bad news. Italy, which was catastrophically hit in the first wave of the pandemic in the spring of 2020, a year later is back under lockdown. COVID-19 cases are spiking alarmingly once again. Prime Minister Mario Draghi said that the measures were necessary to avoid a worsening of the situation that would require even stricter measures. France, which was also hard hit in the first wave of the pandemic, was seeing a spike in cases, and hospitals were seeing the highest number of patients in intensive care units in more than 3 months. The hospital infrastructure was being strained, with some patients having to be transported to other parts of France to receive medical treatment. In Kenya, with COVID cases on the rise, a prevailing curfew was extended. Meanwhile, in Turkmenistan, officials in that country were claiming that there were no cases of COVID-19 there at all. This narrative was at odds with reports via Radio Free Europe, Radio Liberty, signaling a very different reality on the ground, one where Turkmenistan was actually being hit by the lethal pandemic. Some developing countries like Afghanistan, Bhutan, and Cambodia were utilizing their influencer surveillance system to battle the coronavirus pandemic in their countries with some success. Now to the politics of the vaccine supplies and procurement. Ecuador, Peru, Argentina, Jamaica, and Spain were among the countries dealing with what we will call vaccine queue jumping scandals, as public officials in those countries sought to game the system. Of those countries, Argentina was relying on Russia's Sputnik COVID-19 vaccine for its supply. As to Russia, it was accusing the United States of America of carrying out a disinformation campaign aimed at discrediting that very Russian-made Sputnik vaccine. Meanwhile, thanks to a donation of Indian-manufactured AstraZeneca vaccines, countries of the Caribbean Economic Community, CARICOM, were receiving their vaccines from India. Among the grateful countries were the Bahamas, Barbados, and Trinidad and Tobago. Tiny Trinidad and Tobago, however, was leaving nothing to chance, instituting a sophisticated three-pronged approach to vaccine supplies. In addition to the Indian supply of AstraZeneca, it also secured vaccines via the COVAX facility in cooperation with the World Health Organization. As well, a third prong of the procurement plan was via bilateral discussions with vaccine developers. Chile's efforts at vaccine supply procurement is perhaps the most impressive in the world. Going all the way back to late 2019, Chile was working with the Chinese pharmaceutical company Sinovac Biotech, with an agreement already underway to collaborate on vaccine research. And now with COVID-19 on the rise by the start of 2020, Chile wasted no time in convening formal negotiations with vaccine manufacturers. One pathway to getting vaccines into the arms of Chileans included being part of clinical trials with Sinovac, but Chile was also diversifying its outreach, connecting with another Chinese pharmaceutical entity, CanSino, as well as with Janssen and AstraZeneca, ensuring that Chile was part of clinical trials with those entities as well. By March 2021, more than 25% of Chile's population had received at least one shot of vaccine. Chile has thus distinguished itself as one of the leaders in the world and in the Americas when it comes to vaccinating its population against the coronavirus. But as to the other world leader of vaccinations, that title likely goes to Israel. In March 2021, more than 5 million Israelis had received the first dose of the coronavirus vaccine, and more than 4 million had received their second dose. The United States is starting to do a better job in this regard. This week, after signing a $1.9 trillion COVID relief and economic stimulus package into law, United States President Joe Biden announced that all Americans will be eligible for vaccinations by May 2021. The president also announced that Americans could look forward to some degree of normalcy by July 4th, Independence Day in the United States. Next week, I'm going to cover the question as to why COVID-19 has been harder on the United States, the United Kingdom, and other countries of the West and Latin America than less developed countries in Asia and Africa. But before I close, I have some personal reflections on the global pandemic. A year ago in March 2020, everything across the world, as we've known it, changed when the novel coronavirus, COVID-19, was declared a worldwide pandemic by the World Health Organization. Despite warnings from public health officials and infectious diseases experts that things would likely get worse before they got better, it's highly unlikely that any of us realized how much worse things would actually become. The number of coronavirus cases in the United States, a developed nation, has been staggering. The death toll in this, the presumably most powerful nation on earth, even more staggering. As noted by President Joe Biden during his address to the nation on March 11th, the nation has paid a heavy price in blood. COVID-19 has now killed more Americans than World War I, World War II, and the Vietnam War combined. The difference in this case, however, was that the enemy was a virus. The families ever destroyed from this pestilence aside, the financial crises produced aside, there were losses of other kinds, a loss from community, from relationships, from friendships, from gatherings, from the simple joys of touch, of human connection, and a hug of a loved one. As we mark a year of living with the coronavirus pandemic, with all the disruption, and yes, with the pain that it has caused, this is also a moment for hope and celebration. We have hope for a moment when we can return to the simple pleasures of being together once again. And it is time to celebrate science and technology that has produced the vaccines that will help save lives. CountryWatch extends its sympathy to all people across the world who have lost ones to this pandemic. We likewise extend our solidarity to everyone who has struggled to make it through this unprecedented time in human history. As the editor-in-chief at CountryWatch, if there is some degree of a guiding ethos, it is my belief that we live in an interconnected world. That is a lesson that the pandemic has taught us with visceral and intimate truth as regards public health. For more information about these and other stories, read my weekly political intelligence briefing and my coronavirus report, both of which are accessible from the front page of the CountryWatch website at www.countrywatch.com. Thank you for your time. Have a great day. And yes, please do remember that now more than ever, we live in an interconnected world.